Hello everyone. So as the clouds gather and raindrops pitter patter on our windows, the much awaited monsoon season graces us with its presence. While the rainy season brings relief from the scorching heat, it also comes with its own set of health challenges that demands our attention and care. Today, we are delighted to welcome three distinguished experts in the field of medicine who will shed light on the effects of the rainy season on the human body and share valuable insights to help us stay healthy during this time. So we have Dr. Shalini, an eminent pediatrician with over 17 years of experience in Noida, who specializes in general pediatrics and holds certifications in respiratory allergies and immunology. Her vast expertise includes dealing with children with disease related to the respiratory system, making her an invaluable resource for understanding the impact of the rainy season on young ones. Next, we have Dr. Amit Kumar Pandey, a renowned internal medicine specialist with over 12 years of expertise in Delhi NCR. He brings a wealth of knowledge in managing a wide range of health conditions. His insights will help us comprehend how the rainy season affects individuals and existing health issues and how to navigate through the challenges present. Last but not least, we have Dr. Vishal Khurana, a highly experienced gastroenterologist based in Metro Hospital, Faridabad, with more than 11 years of professional journey in medical gastroenterology. Dr. Khurana will enlighten us on the impact of the rainy season on the digestive system and ways to safeguard gastrointestinal health during this time. During this live session, we will explore the common health risks associated with the monsoon, including waterborne disease, respiratory challenges, and allergies that may emerge during the season. Our esteemed panelists will share practical tips and preventive measures to keep you and your loved ones safe and healthy throughout this rainy season. So join us for this informative and interactive discussion as we embark on a journey to better understand the effects of the rainy season in the human body and equip ourselves with the knowledge to embrace this season joyfully while prioritizing our well-being. So my first question to Dr. Shalini, ma'am, what are the common health issues seen in children during the rainy season and how can parents protect them?
Thank you, Afan. A very good afternoon to everyone. So, rainy season comes with a many morbidities. We see children sprouting into our clinics, crowding them, with a lot of issues like diarrheal diseases topping the most. Typhoid is another infection. We recently had a spurt of typhoid and so many admissions happening in our hospital. Then we had uh, flu infections, viral respiratory infections as well. Waterborne infections like hepatitis A definitely was there. And apart from that, we did have spurt in allergic cases, like we had asthmatics who have had an exacerbations during this period. So monsoon is loaded with different kind of diseases. May it be respiratory, GI, may it be allergic diseases and skin issues too.
Thank you, ma'am. So moving on to the next question with Dr. Amit. Sir, how
Yes.
does the rainy season affect our immune system and what precautions can we take to boost?
Basically, in the hello everybody, I am Dr. Amit. Uh, thanks for giving me the platform to tell the everybody that how we people encounter, how we especially how the doctors encounter the so much crowd during the monsoon season. Uh, in the beginning of the monsoon season, there's a sudden temperature changes there, so that the humidity increases. As soon as the monsoon season reaches, humidity increases, which leads to the dehydration, and dehydration leads to the water disturbance in the body, and which leads to the depress of the immune system, so that we are susceptible to so many diseases. So this is the main reason. And we can treat it also with the help of adequate hydration, electrolyte balance, and many such things. So these are the main important reasons so that we can help people
Thank you
to
so
boost the
much.
immune system. Along with it, our dietary habit, drinking frequent water, citrus juices, fruits, walnuts, almond, curd, like probiotics. Like Doctor, our gastroenterologist expert will tell you that probiotics will also improve the gastrointestinal immunity. so that these things can lead to the healthy lifestyle in the monsoon itself.
Okay, thank you, sir. So, my next question to Dr. Vishal. So, what are the best dietary practices to follow during the rainy season to stay healthy and avoid gastrointestinal issues?
Yeah. So during monsoon, and there is so many risk of infection. Mostly the infection are respiratory and the foodborne infection. So to counter that, when you are going outside, try to eat whatever is healthy. Don't buy any food which is not served cooked. So try to get a cook, properly hot food servings, and instead try not to have open food. And when you are at your home, and try at that time, try to maintain your hydration and eat healthy food material. And it's very important that you wash your fruits and vegetables cleanly, and wash your hand properly before taking any kind of food.
Thank you, sir. So, Dr. Shalini, are there any special precautions that a pregnant lady should take during the rainy season to protect their health?
Sure, Afan. So what happens is pregnancy per se is a stage when the infections aren't handled very, as we are expected to handle them. So the pregnant women can get more infected. That is one. Second, like all other infections, like everyone has to do, the pregnant woman has to be a bit more careful in what she's eating. As Dr. Vishal clearly said that the water is easy to get infected. So any food items where the water contamination can be there, it can be our roadside golgappas and tikkis where the pregnant mother usually likes to have it. She really needs to avoid that during this season. And even if she's craving for some food from outside, let it be something that is cooked at a higher temperature, to kill the bugs. Yes, that's one. Second, lots of fluid, hydrating. In monsoon, sometimes we forget to drink as much as liquid as we're supposed to. So she's supposed to drink a lot more water. Third, come what say, in our northern of India comes the monsoon and we start frying our pakoras and we start having a lot of spicy foods. And pregnant women have a more tendency to get gastritis and vomitings, right? So she will have to protect herself from, she'll have to restrain there. Then the mosquito borne disease. Immediately after monsoon, the mosquitoes are rising. We can see that happening in Noida these days. Dengue fever and malaria suddenly start increasing. It's difficult to handle these infections once the woman is carrying a baby. So she has to be a bit more particular about protecting herself from the mosquito bites. So all the precautions which other people will have to take in monsoon, it will be doubly increased in pregnant women because of her precarious state.
That's a very good answer from you, ma'am. So, my next question to Dr. Pandey. Sir,
Yeah.
are there any specific vaccines recommended for the rainy season and who should consider getting them?
Basically, especially this question goes to Dr. Shalini itself. That it is not for the adult people. Basically, the people who are getting reinfected again and again infected from typhoid. So basically, those are the candidates. Second, hepatitis A vaccination is also very important. Second, third, I don't think any other vaccine is needed at this stage in the
Can
rainy
I chip
season.
in, please? Let me chip
Yes,
in.
ma'am. Sure. Yes,
Sorry,
please.
sorry, sorry.
Let me chip in. So I would ask, there is the concept of adult vaccination is so much lacking in our country and which is so much required. So typhoid is a vaccine required for all of us. Hepatitis A, who have people who have not suffered with hepatitis A in past or have not taken the vaccine should be taken. Flu vaccine every, because the in our country, the Southeast Asia including India, the flu spikes are one in monsoon and second in winters. So just beginning of the season, a flu vaccine is definitely advised. Now, if there are cholera outbreaks, then we give you a cholera vaccine. We don't give you cholera vaccine routinely to everyone. So if there is a place where is a spurt of cholera cases happening, it will be good to take the oral vaccine for that. Apart from this thing, I would want to, since we're talking about vaccines, not particularly to monsoons, in adults also, DTaP vaccine should be taken, the tetanus vaccine, along with a smaller dose of diphtheria and tetanus every 10 years. And one dose of pneumococcus vaccine till 45 years of age is advised even for healthy adults. And then there are other vaccines for immunocompromised people. So I would want to use this platform, go beyond monsoon and try to educate people for adult vaccines as well.
Right, Dr. Shalini will take care of those things.
Dr. Pandey,
Yeah.
I'm going
Thank
to
you
give
so
you
much.
these vaccines.
Yeah, thank you so much, Dr. Shalini. This is always underrated issue.
Yes, it
Okay, so moving on to the next question with Dr. Vishal. So, what are the potential risks of food contamination during the monsoon, and how can we ensure food safety at home?
So monsoon is the, as you know, the monsoon there is humidity as well as water also. So there is a high chance of getting bacterial and fungal infection during this period. So food are at risk to get all these kind of infection. So during the monsoon and rainy season, there is high chances to get foodborne diseases because they are likely to get contaminated with contaminated water and humidity induce bacterial and fungal overgrowth. So to maintain proper hygiene at home, two or three things should be done. First, wash your hand properly. Wash your fruits and vegetables properly. Third, close your doors as well as the windows so that there should not be any mold growing over there. Fifth, mop your floor because sometimes what happens is the bacteria or fungus they basically enter via all these routes only by the windows and doors. So clean your floor, wash your utensils, wash your fruits and vegetables, and wash your hands. And try to eat whatever is served cooked hot. Don't use over
Okay, thank you, sir.
open.
Okay, so Dr. Amit, so what are some common
Yes.
myths and misconceptions about health during the rainy seasons that needs to be debunked?
Basically, our food habits, number one, hygiene, number two, कि खुल के चलते हैं नहाने पानी में बारिश में, not like that. पकोड़े खाते हैं like मैम said कि चलो बाहर पकोड़े खाते हैं छोले भटूरे खाते हैं. It's not like that. Our food habits must be very important. Number three, कि खुले में नहीं रहना है, not in outside. We have to prevent ourselves because prevention is always better than cure. And that is the way we can educate the people. Ki we have to. These are the myths and concepts. Our food habit, our living habit, our hygiene, our protection of ourselves from dehydration. Avoid the habit as our gastroenterologist Dr. said that कि बाहर का खाना नहीं खाना, not food outside. मतलब street foods are not allowed at this time. So these are the myths and concepts. So we should avoid it.
Okay, so Dr. Shalini, ma'am, how can we manage allergies and respiratory issues that often worsen during the rainy season?
Okay, fine. What happens is during the rainy season, there are certain type of grass pollens which are going to increase, right? Second, the humidity increases the spread of these pollens. So those set of people who are particularly sensitized to grass pollen will exhibit more symptoms. You will have people itching their eyes a bit more often, rubbing the eyes, rubbing the nose, sneezing more often, and some people who have tendency of asthma end up coughing and panting a bit more. So the first thing is we have to identify these set of parents, people, and usually people will tell you they identify these seasons. This weather doesn't suit me, or the Diwali weather doesn't suit me. So we can always go and figure out what they are allergic to. Avoidance measures, the pollens are highest during early mornings and sometimes in the later evening. So even if they're going out in a park to walk or something, ask them to avoid the morning time when the pollen density is very high. They can do that in the afternoon, the weather permits, or they can do the activities where the grasses are less. Rolling in the grass and playing in the grass. For these set of parents is something we can ask them to avoid. That is about your respiratory allergies. Amongst the skin allergies, because it becomes a lot humid and the pores also get blocked, so underlying allergies will worsen here. So we ask them not to use lot of lotions, to layer their skin. It might lead to increase in allergies as well as infections, skin infections. Not clog the pores with powders. Try to have cotton and loose fitting clothes, something like that. So that will really help them keeping the skin healthy at the same time too.
Thank you, ma'am. Dr. Vishal, so what are the signs of dehydration and how can we stay adequately hydrated during this rainy season?
So basically, what people usually during dehydration feel is they feel more thirsty. They pass dark color urine and they feel weakness or dizziness when they stand up. So to maintain that, try to have at least 3 to 4 liter of water per day, or you can have more fruits and vegetable during this period. That's the basic way to stay yourself hydrated.
3 to 4 liters. I'll remember to do that.
Okay. So, Dr. Pandey, so what are the most
Yes.
effective ways to protect ourselves from mosquito-borne disease like dengue and chikungunya?
As I already said that prevention is always better than cure. Number one, we have to. Doctors have told that we have to use mosquito nets, repellents. So these are the practices through which we can protect ourselves. Number two, uh, we have to protect the storage of water, either clean water or old water, like in the coolers, in our bathrooms. Usually we find the mosquitoes over there. So we have to throw that water. We have to clean the place. Along with it, regular spraying of DDT and sprays to kill the mosquitoes. So these are the measures. Along with it, use the full button shirt, full shirts, and pants during the outside visits because there are propensity and tendency that some mosquitoes are active during the day and some are active during the night. So we have to accordingly manage that. So these are the safe practices to prevent the diseases from chikungunya, dengue, and like so other ones. So we have to tell about the and we if we see the news channels, they are also and government are also telling again and again that use these practices to avoid the people from getting infected through these diseases. So these are the things.
Okay, so my next question to Dr. Vishal, sir, does the rainy season has any effect on chronic gastrointestinal conditions like irritable bowel syndrome or IBD? You can select IBS or IBD, and how can patients manage their conditions during this time?
So IBS and IBD patients, they are more more prone to get infected, and if somehow they get GI infection during this period, they are likely to suffer more. So inflammatory bowel disease with overlying infection, they will lead to flare. So it is better for these patients, IBS and IBD patients, to prevent themselves to get infected. So avoiding outside food and taking properly cooked food is the basic cornerstone to avoid infection during this period. And these people are likely to suffer more. Their bowel is more prone to get disturbed during this period.
Okay. So my next question to Dr. Shalini, ma'am, what are the best ways to engage children in outdoor activities during this rainy season by ensuring they stay active and healthy?
Uh, could you please repeat that question?
Yes, ma'am. So, ma'am, what are the best ways to engage children in indoor activities during the rainy seasons by ensuring their activeness and their health?
Uh, Afan, I would, yes, I will answer that question. Before answering that question, is it wrong for a child to go get drenched in a nice rain and enjoy? I would say
No.
no. I would really say no. That is what childhood is. So rather than restricting a child to do all these things, I'm not saying to do that every day or do that something. I'm just asking parents to build a good immunity so that the child doesn't fall sick on getting drenched in a single rain. How do you do that? You eat well, you sleep on the right time, you have a good physical activity, your diet is balanced, and then you're vaccinated on time. If I find a child who is a couch potato sitting in front of the TV, eating junk food all the time, sleeping, is awake till 2 or 3 a.m. and gets a plate, doesn't have a good bowel habit, this is a child who's more likely to get infected even on a minimal exposure. So, first, to handle any infection or something, build immunity. Build immunity by basic fives: diet, exercise, stool pattern, restricting the screen, that's what you need. Now, coming back to staying indoors and doing activities, another very, very important aspect that all of us need to understand. As you all must know, everybody has seen the incidence of autism and autism related disorder, communication disorders increase leaps and bounds after the COVID and children were inside and watching TV. So it's important to keep them away from the telly, any kind of screen. All indoor activities, starting from, it depends upon the age the child is in, it can be a simple board game or a block, and I would insist a simple household core is enough to keep them busy. Why not they just plant some pots or help the mother laying a table? Why these simple things have kind of vanished from our households? They keep the child, they channel their energy into something constructive rather than sitting and doing something, you know uh, carrying it all over. So this would be my suggestion to every mother out there.
Thank you, ma'am. Dr. Pandey, sir, how
Yes.
can we differentiate between monsoon-related viral infections and more severe illness like dengue or malaria?
Yes, it is a very good question, basically,
You need Dr.
because
Pandey for that. You need to go to Dr. Pandey.
of course, these questions are interrelated itself, because you are telling that these are the severe viral infection. Severe viral infection is also mosquito-borne infection. So when we find out the illness like upper respiratory tract, number one, number two,
Oh, oh, I guess we have lost him. So let's continue this session with Dr. Vishal. Sir, what should I do if I suspect food poisoning or an infection related to consuming contaminated food or water?
So there are two aspects. You are asking about the food poisoning. So food
Yes, sir.
poisoning is basically caused by the toxin present in the food material, and second is gastroenteritis caused by bacterial or viral infection. Both are separate things. So if the person is having food poisoning, the only and the best way is to hydrate the patient and to give symptomatic treatment so that the person is relieved during that period. And spontaneously, the body itself heals and the intestine epithelium basically regrows, and the person goes well after that. And if the person is having the infection, you need to treat the infection provided it is bacterial infection. You don't need any antibiotic for viral infection, which are the most common cause of gastroenteritis during this period. So, adequate hydration by oral or IV route and symptomatic treatments for pain, nausea, vomiting, and diarrhea during this period. And spontaneously, within 2 or 3 days, person usually recovers.
Thank you, sir. So, Dr. Amit, since you have joined
yes.
back, so would you like to continue the
Yeah,
answer,
yeah,
sir?
of course. I would like to continue. That there are very subtle difference. You cannot distinguish it clinically. Number one, the milder diseases, the shorter course of duration, and early diagnosis, early contact with your physician will lead to treatment of these diseases. Will lead to the protection from these diseases. They usually subside from 3 to 5 days. And if it is persisting more than 5 days, along with it, the symptomatology, the like dengue, malaria, they will give typical symptoms like persistence of fever, high grade fever, headache, backache, rashes. Along with it, so many symptoms are there like gastroenteritis, like joint pain, like polyarthralgia, like headache, backache, rashes. So If these symptoms are there, then we have to think additionally. Yes, of course, patient is suffering from monsoon-related illness, but maybe added he's suffering from dengue, malaria, chikungunya, typhoid. So we have to investigate it first. So contact with your physician is a very, very not only physician, contact with the doctor is very important at this juncture. So that is why we can tell that these diseases are shorter duration, milder in course. If it is persisting and disease nature is severe, then we have to treat it accordingly. We have to find it out what exactly we have to do with that. So these are not different things. These are same things. Very overlapping features are there. So it will be assessed only by the expert person when go timely with your physician.
Okay, so thank you, sir. And the last question with Dr. Shalini. Ma'am, are there any specific dietary recommendations for kids during the rainy seasons to support their growth and immunity?
I guess this is being repeated all over this talk, but yes, let me just go enumerate them. One, hydrate. You don't feel thirsty much in monsoon, so hydrate. Drink adequate water. Two, limit outside food which gets contaminated easily. The water gets contaminated easily. The hot and humid environment is very conducive to the growth of bacteria, which causes diarrheal diseases, typhoid, and hepatitis A. So these are waterborne diseases. So contaminated water and should be avoided. So contaminated water can be there in street foods as well. The golgappe ka pani is contaminated, right? Then eat a lot of fruits. That will give you not just the hydration, lot of electrolytes, lot of antioxidants to help you help the immune system remain better. Have a nice, good, balanced diet. A diet which has adequate proteins and carbs and fats in a balance. It's not having too much of carbs and less of protein is a very important aspect, monsoon or otherwise, to keep a person healthy. And then protect yourself from mosquitoes, especially dengue is the daytime mosquito bite. It happens, we get so many children with dengue because they go out and play in parks. So if you're playing in the parks, wear full clothes, apply mosquito repellents if you have to, but protect from the bites daytime, nighttime, both, right? Using machardani and other measures to prevent mosquitoes is required. So and vaccinate. Flu vaccine, hepatitis A, typhoid vaccine should be given. Water, food, fruits, mosquito bites, vaccinations, and for allergies, as I've told you, people who are allergic should be avoiding that particular time to go into the park. Yeah, that sums it up.
Okay, so thank you. That was the last question from my side. Now I'll take those questions which we have received through our chat box and the comment box. The first question in that regards is, hello doctor. 3 months before I suffered from typhoid and still after having antibiotics yesterday, I have done blood sample test for Vidal and typhoid. Reports showing typhoid test negative, IgG and IgM both negative, but in Vidal test, S typhi 0 is 1 is to 160, which is positive, and remaining 3 are 1 is to 20. Is it typhoid coming back? I am feeling weakness and loss of appetite and feeling little fever, but temperature is normal. Answer will be appreciated. Thank you. Dr. Amit, would you like
Yes.
to take this question?
Yeah, of course. I would like to take this question. There are two possibilities. Number one, the recurrence. Number two, that probably it will be the community titer of 1 is to 160 of Vidal. So number one, number two, temperature charting is very important. Along with first of all, contact with your doctor. Number one, number two, temperature charting. Number three, associated symptoms. Number four, go get it done. CBC, CRP, ESR, liver function test. So get a panel done. Along with it, blood culture for Salmonella typhi and Paratyphi. Along with it, one ultrasound is also needed. And 3T tests, typhoid fever, till proved otherwise. So this is the only method by which we can find out. Basically, probably it is not typhoid, recurrence of typhoid. It is a community titer. Along with it, some sort of viral infection is superseding on the earlier entering infection. So body which was recovering having another bout of some sort of viral infection is there. What I think so. So that need to be evaluated properly.
Thank you, sir. So there is next question. Uh, I have been diagnosed with dengue 2 weeks earlier, and once my fever subsidized after a week, but there are rashes, convalescent rashes, white islands in the sea of red over my hand and legs, and it is somewhat itchy. It usually comes after the fever subsides, but I'm not sure how long it will last. Can you please guide how many days it will disappear?
Basically, can I take this question?
Yes, sir. Sure. Please, please.
Of course, the rash is usually go in next 2 to 3 weeks maximum to maximum. It will not persist. So need not to be panicked. Get evaluated properly. Get the CBC done, LFT done to rule out other possibilities associated with dengue fever, and treat it with simple cetirizine also with your symptomatic treatment. Take cetirizine and some sort of Caladol lotion, and it will usually fade in maximum 2 to 3 weeks. It will not persist. It will completely go away.
Fine, sir. Next question is, hello, doctor. My question is, during this rainy season, many people suffering from ice flu. Please suggest how to cure it. Dr. Shalini, ma'am, would you like to answer this question?
Like any other eye flu comes in a outbreak, sporadic kind of a thing. Use minimum antiseptic eye drops. Clean the eyes properly. Hand wash. Do not touch the eyes.
Okay. So, well, that was the last question. And before winding up this session, I would request the panelists to share the take-home messages with the audience. So, let's start with Dr. Shalini, ma'am, from your side.
My advice to everyone would be the first, build health. Build good health by having a good sleep, diet, exercise routine. Second, avoid very high risk behaviors at the cost of not restricting the children's life. They don't need to be homebound because outside there is infection. And third would be identify the red flag sign of any infection. So fever is bound to occur, but if the fever is with a rash, too many vomitings, the child is, you know, feeling too low or has maybe very high grade fever, urine output is less, then this is not a right fever. Go to the doctor at the right time, vaccinate properly, prevent mosquito bites, enjoy the rains, have pakoras.
Thank you, ma'am. Dr. Vishal.
Yeah, my message is stay hydrated, wash your hand properly, don't eat cut foods, try to eat properly cooked food, and try to have banana, apples, and berry in your food items. That will help you out.
Thank you, sir. Dr. Amit.
And use purified water.
My message is to protect yourself from mosquitoes and outside foods and safe hygiene, drink plenty of fluids, have good sleep, have good food. That's it. Stay healthy. That's it.
Well, thank you, panel. Okay, so thank you, everyone. And as our insightful this session on the impact of rainy season on health ends, we extend our heartful gratitude to our esteemed panelists, Dr. Shalini Tyagi, Dr. Amit Kumar Pandey, and Dr. Vishal Khanana. Their knowledge and expertise have enlightened us all, empowering us to navigate the rainy season with great awareness and confidence. We hope that the information shared today will serve as a valuable resource for you and your loved ones. From understanding the challenge posed by waterborne disease and respiratory illness to practical tips on maintaining digestive health, we are now better equipped on safeguard ourselves during this vibrant yet health-sensitive season. Stay connected with us to be informed about such and more informative sessions in the future. We are committed to bringing you expert insights and valuable discussions that contribute to overall health and wellness journey. So, thank you
Thank
to all our viewers who has joined us live, engaged with their questions, and participated in this meaningful conversation. Wishing you all a safe, healthy, and joyous rainy season ahead. Remember, knowledge is power, and together we can overcome any health challenges that comes our way. So take care, stay well, and thank you.
Thank
Bye
you.
bye.
Thank you
Thank
very
you so
much.
much.
Bye.